We are trying to present about what is CMC and what is our mission vision and what we are going to do in our organization. So we wanted to show this documentary and present you people so you will get idea from what we actually doing and what is our vision and mission.
CMC-Nepal was developed from United Nations Nepal. Women worked in 1984 to address the mental health needs of the country. It started the community mental health programs from South Lalitpur, which is a pioneer project of the nations. Gradually, it developed many programs here together with Institute of Medicine, CMC-Nepal here. We registered this organization in 2003, and it is also affiliated with the Social Welfare Council here. It mainly works here for the preventive, promotive and curative aspect of mental health here together with other organizations here. At the moment here, due to the conflict of the country after post-war situations, CMC-Nepal is trying here to address the psychosocial needs of the conflict affected people also here. Mainly CMC-Nepal, it works here. Its vision is individual and the communities here of Nepal are aware of and can promote good mental health in their daily livings here. Here, CMC mission here is to provide capacity building and the support to organizations, international, nationals and the government, empowering them to promote awareness about mental health issues and provide quality mental health care as part of their programming, ensuring local ownership.
About mental health in Nepal is very poor, in short, we can say. The infrastructure, the available services, the available manpower, everything is scarce. Nursing staff have not got proper adequate trainings on mental health. We have problem with the social workers, no facility for outpatient therapy, and many basic needs are also lacking.
The situation of the patients is very pitiable still. There's a very high level of stigma against it, which has to be fought. And the general non-availability of staff and drugs is there also.
Overall, we estimate that about 20% of the population in Nepal suffer with some kind of mental illness. Psychiatrists, those who are working in Nepal, are now 42. Psychiatric nurses are about 8. They are not many. And there are no psychiatric social workers as such. Clinical psychologists are 7 in the country. There is only one mental hospital in the country. It is a 50-bedded hospital in Kathmandu Valley.
Simon's Institute is an organization that supports rural healthcare workers, and one of our supports is training them. And so several years ago, when we were looking for a partner in the mental health field, CMC-Nepal was the obvious choice. I'd worked with CMC over the years through my work in United Mission to Nepal, and the quality of their work, the breadth of their experience drew me to them.
I'm looking after community mental health and psychosocial program. So under that program, we are conducting 10 days basic mental health training, refresher training with supervision visit as well as meetings. So then we do have program in basic listening skill, trauma related issues, and counseling for local NGO staff with regular supervision. And another aspect is drastically change in the community about the awareness about mental illness, mental health in the community because of the media program, through media program, FM radio in many districts. Also we conducted training for the female health volunteer, traditional healers. So there are also referral cases in the health institution.
The second program is about the child mental health programs, which is a very unique programs. As the name also said, program aims to promote and prevent mental health problems among the children and adolescents populations and promote their psychosocial well-beings through the existing education systems and make available of the mental health services through the available health systems where also mental illness of the parent of the children are also treated. Education teachers are trained to identify the behavioral and emotional problems of the school children and intervene at school level and refer the difficult cases in the child guidance clinic established in the district.
I'm doing work in CMC as a psychologist cum field coordinator for the child mental health program Dulaka. Especially child mental health program is aimed to decrease the suffering of children and adults and adolescents from stress, trauma and mental illness. Its main goal is that. And then its objectives is to create the proper environment in schools for the promotion of the school children. And another objective is to improve the access of the mental health services and then psychological support to the affected people. Altogether, we have running our programs in 69 schools. Due to the conflict, a lot of children, very large number of children are suffering from the problem. 12 to 15% children are suffering from emotional and behavioral problem. They are psychologically disturbed and they need services, mental health services or psychosocial support.
Third programs is about the psychosocial support programs for the direct war affected children and their families. Shortly, this program is named very local name of Nepali with a mala. It's a flower garland, which reflects that the program attempts or programs has a aim to reintegrate the separated children and their families and build the emotional tie-up so that their psychosocial well-being will be improved and the traumatic experiences which they had during the intense war period they will get the opportunity to ventilate and recover slowly out of that so that they can resume their normal life and will be able to better cope the stresses and the fear that they have since the war. This program runs in 4 districts of the Midwest, Sallan, Rolpa, Tailek and Jumla. where 4 local NGOs are selected, and each NGO has 3 social field workers who are received extensive training on psychosocial support and counselings, and they are working in this project since last 3 years already, and they have been supporting almost 800 children and more than 350 families. And they are visiting these families and meeting the children in their families itself and in the schools also. And this program is being supported by the terrorism's CMC-Nepal, Swiss INGO.
Our social worker always goes in the home to home, door to door. Then they visited family member and children also. And we, in a year, we also goes to supervise them in the field, door to door and home visit also. And I found very effective also this program.
I've really appreciated the way CMC has developed over the last 3 years, has developed the capacity of the workers, the social workers, who are young professionals from these areas, who have, who in the beginning had no experience, very limited experience in the field of mental health and psychosocial. The children who were affected by conflict are recovering. We can see them playing with little toys that the field social workers are taking with them and giving to the child. We can see the face of the child all of a sudden changing as soon as they see them in the village. When they see the field social worker coming, I saw the face of children really lighting up, and that shows that they've become their friends, and they're providing this invisible support. I would describe CMC in a few words as to say that they're giving a voice to these people who have suffered from conflict, and they're also experts in the invisible, experts in providing this mental health that is so necessary after conflict, mental health that is ignored by most actors.
The 4th program is about, again, CMC is not only working truly in the mental health and counseling, it attempts to build the capacity or to empower the project staff of the developmental projects, so that they are better able to understand the disempowerment process because of the psychological factors like trauma due to the war or the social violence or due to domestic violence or due to the extreme social exclusion or poverty. This project is called as a Support for Effective Empowerment, shortly CSEE, being supported by SDC, Swiss Agency for Development Cooperation, Nepal. And we are supporting in their 7 different projects, so it's like that we are working and building the capacity of the project staff to understand psychosocial disempowerment factors and empower the staff so that they can better understand the community people's psychosocial situation. The other project of CMC-Nepal is again psychosocial support project, which works on the brick kiln workers. Again, this project is being supported by the Terrorism's Nepal, TDS Nepal, under the funding support of SDC. Here we are supporting in the building of the capacity of the social mobilizers who is working in 20 brick kilns in Kathmandu and Bhaktapur districts. The workers in the brick kilns, they are the seasonal workers from November to June. Mainly are working in a very hard and very difficult situations.
CMC is working to support the Bricklane project, which is supported by Tourist Homes and organized by Chemiki, which is an NGO. And CMC is supporting it in the psychosocial part, especially in the supervision and the training part. We supervise mostly the problems and the issues which exist in the bricklanes, like sexual-based violence or other issues like even nutrition or so many other women's issues, children issues, all those issues. And we support the social mobilizer and also help them to enhance their skills and knowledge through the training that after the supervision.